We're live? My lipstick look good? Good morning, everybody. Buenos dias, almost afternoon, and welcome on behalf of the library's Board of Trustees, on behalf of Director Betancourt, the North Public Library, and the New Jersey Hispanic Research and Information Center. Welcome. For the first time, some of us, and welcome back, of course, to some of our returning guests. Just a little housekeeping. You need to use the restroom. We're off out these doors to the left. And my name is Yesenia Lopez. I am the director of the New Jersey Hispanic Research and Information Center at the North Public Library. And it's just known as the HRIC for short, because that's a really, really long title and I lose my breath saying it. So if you hear me say reference, the HRIC is the Hispanic Research Center. So the Hispanic Research Center here at the library actually consists of the Puerto Rican Community Archive, where we house primary source materials on the Puerto Rican communities of New Jersey. So we're talking about as far south as Cape May County, all the way up to Sussex County. We're documenting those communities in the archives. It also consists of a Hispanic reference collection where we keep bilingual research level books on all Hispanics in New Jersey. It consists of some oral histories as well as some reference books by and about New Jerseyan Latinos. And the Sala Panamericana is the third component of the HRIC. That's actually located right across our hall from where we are. It is a completely Spanish language library geared towards our Spanish dominant patrons. It houses the largest Spanish language book collection of any public library in New Jersey, has computers configured to Spanish that I admittedly don't know how to work, but those newly arrived immigrants who do know how to work, right, have that available to them. So as director of the HRIC, I oversee these three departments, and I'm in charge of bringing Latino programming to the community. And we actually have once a year celebrate, starting at the same time as Hispanic Heritage Month, but we do what we call a Latino celebration because we cannot be confined to 1 month here. We actually program throughout the entire fall. And this year, it's based on a different theme every year. This year's theme is Latino athletes, empowering communities through sports. And so this year, well, every year we have an exhibit and series of programs. This year is going to be focused on that theme, where we're going to highlight how athletes and sport organizations empower communities and the barriers that were broken along the way. So I want to make sure everybody stay tuned to our upcoming celebration and programs. Check out our website, www.mpl.org, our Facebook page, our Instagram, hello to Facebook, and check these out to find information about our programs. Also, if you have a program idea that you'd like brought forth, you'd like to see here at the library, please call my attention to it and let me know. On that note, I'd like to make sure and get today's program started. And thank you for sure to our community partners who helped get this program together. I want to make sure and thank Ivana Hill and Devin Weber with Ifwin House North Chapter for sure for coordinating this program. I recognize Dr. Nadia Glenn with the State Department of Human Services for agreeing to moderate and traveling a long way to be with us in person. We thank you very much. And of course, to our panelists, Alrima Vaini. Thank you all for joining us, and to thank, of course, the City of Newark for your support in our programs, and to share some welcome words from the city. I'll invite and thank, of course, Maria Andrade, who is the person who brought this program idea to my attention. Thank you.
Buenos días. Buenas tardes. It's always a pleasure to work with the community. When this idea was brought up to my attention, it was all hands on, and we are so thankful for continued partnerships with the Newark Public Library, with the Department of Mental Health. It is so imperative that we continue to work together. On behalf of Deputy Mayor Alicia De Fritas, she welcomes you to the city, and of course, let you know that we stand ready to support each and anyone that needs any help, especially from the doula community when it comes to female and especially female health. We stand by ready to help and empower, and we thank you, each one of you, for your time to be here. And I will welcome Ivana Hill to speak further.
I'm Ivana Hill. I'm going to give a very quick presentation, basically some background as to why conversations like these are so important. Okay, cool. Now we can start. So throughout the nation, communities of color are experiencing high maternal mortality rates. In New Jersey is ranked 47th in the nation for maternal mortality. It has one of the widest racial disparities for both maternal and infant mortality. Black women are 7 times more likely to die from birthing complications than white women. And Black infants are 3 times, and Latino infants are 2 times more likely to die before their first birthday than white infants. During the COVID pandemic, Latina women have experienced a 74% increase in maternal mortality rates. And not only this, but Latino women's health outcomes are not being reported properly. And this is a barrier to possible services that they may need. So some reason behind these disparities are, there's many reasons why these disparities exist, but the main reasons are racism and discrimination in the healthcare system, and a lack of access to prenatal and postpartum care. So the way that New Jersey lawmakers are addressing these unacceptable systems, the First Lady, Tammy Murphy, introduced the Nurture New Jersey Strategic Plan in 2021. And one of the aims of this plan is to increase access to doulas and increase support for doulas. The reason for this is because research has shown using a doula during the pregnancy and after can lead to lower rates of maternal and infant health complications, fewer preterm births, and lower rates of cesarean and higher rates of breastfeeding. All things that are necessary for mothers and their children to live happy and healthy lives during and after pregnancy. So the reason we wanted to put this panel together is to highlight the amazing work that these doulas do in their communities and to support them and to spread awareness. Many people, even though doulas are everywhere, do not know what a doula is. And a lot of these services are right in your backyard. So without further ado, we can start. And thank you, ladies, for being here. I appreciate you all.
Thank you, everyone. I guess we could take a moment and I could just share some of the highlights of the amazing work that our panelists are doing, and then I'll go into the questions if that's okay. So to my left is Alrima, and Alrima is a mother of 3, and she has 1 heavenly blessing. She is a full spectrum New Jersey certified Medicaid doula. She is the owner of Nurturing Babies, which she founded in 2018. And although her business came in the years of the pandemic, she has over 12 years of experience dealing with urban communities, postpartum and newborn care. She serves as a partner to many local and state organizations, serving families of various backgrounds and mentoring new birth workers. She is enrolled at Walden University, where she hopes to obtain her doctorate degree in public health And Arima stands as a doula practitioner specializing in postpartum care and cesarean births, ensuring families receive the love they deserve during and after birth. So thank you so much to Arima. Next to Arima, we have Gloria. Gloria is a private doula and a doula consultant. She was trained by Uzazi Village, and she is the founder of Regalo Births. Am I saying that correctly?
Regalo birth.
Regalo Births. And I'm sorry.
And I'll explain shortly when.
Yeah. Okay. And she is an advocate for Latino mothers, and she feels mothers are often left out of conversations, and she feels it's her role to make sure people are respected, especially in the space of Latino mothers who do not speak English. She advocates for these mothers by making them feel heard and that their space isn't violated by doctors. She's a strong advocate for natural birth, and she feels that C-sections may decrease the number of women or birthing individuals who go into breastfeeding. Then we have Tonique. Tonique is Tonique also was trained through Uzazi Village as a doula. She's been a doula since 2018. And why I'm stumbling a bit is that Tonique has assisted in over 70 births. And that's so commendable. There you go. Tonique is enrolled in Medicaid as a fee-for-service, and she's also enrolled in all of our managed care organizations. She is an advocate for quality, access to care, knowledge and understanding of insurance policy as it relates to doulas. And she wants to facilitate a better relationship between doulas and perinatal health workers, midwives, and providers. And lastly, her favorite population to work with is first-timers. And she wants to support births without epidurals and understand that breastfeeding is the best for the baby and the infant. So this is our esteemed panel. On behalf of the First Lady's office, we just want to say thank you for all the work that you're doing throughout New Jersey and the various communities. And I guess I want to start with, we hear about OB doctors, we hear about midwives. What is a doula? And you can use your heart words, or you can use the definition of what you think a doula is. But what is a doula?
I'm gonna jump right in, and I'm gonna say a doula is a labor and pregnancy coach. Okay, how do I say that? Yes, our bodies have been built for this. We have been giving birth for over 2,000 of years without any assistance, any medical assistance, any professional, the doctors and all of that. It was the villages. It was the village aunties, the midwives, who were not trained. They just took on the role as the elders in the communities that took care of us, took care of the women in their villages and, our ancestors. It was them who took care of it. And it really did take a village to raise one child. And we strayed away from that. We started going with, and that's fine. And I'm all for advancement, but without losing what we are naturally built to do. And it's just, and that goes for the Spanish community. I call it, somos asistentes a la partera. We're assistants to the midwife, because they will confuse that very often. They're like, oh, she's a midwife. No. I'm not medically trained. I am very, very specific about that. I am not medically trained I am here more to be your emotional and physiological supporter while you're going through what your body's going through.
Thank you, Gloria. Tonique or Arima, what did you do?
I would definitely emphasize the non-medical fact of it. I make sure, that's my first conversation. No, I'm not going to help you deliver your baby at home. That I don't do. I'm not going to check you. I'm not going to reassess whatever your medical doctor says, but I can definitely empower you to ask more questions. And if you are told that you need to have a C-section before 39 weeks, don't put it in writing. You want to see why? They tell you have to have a C-section early on. So as a doula, my role is to empower you to learn as much as you can about the birthing experience, your pregnancy experience, so you can be informed and know how to make decisions going forward, how to understand what your body is going through, to make you aware of the need to have a birth plan, to have the things that the baby needs, the assistance that you need as far as breastfeeding, if you've never done it before. I definitely advise to start nurturing, to be a parent before the baby actually gets there. By month 7, I encourage read to the baby every night. Start that process of reading to the baby every night. Talk to the baby all the time. So you also are encouraging the mom to be a mom before she actually a mom, to get in that mindset, know that you are this child's protector, provider, and everything. So I like mama bears. I create mama bears before the baby gets there. And a lot of the times, my moms don't want an in-person visit once the baby comes. I don't care. We can do virtual. But we need to talk. I need to understand what's going on, and understand what you're emotionally going through. So a doula is like your whole support person for the pregnancy, throughout the pregnancy, for labor support. You don't know how many times at this point now, I prefer to get paid for my services, but that thank you for being here is all I really look for. That is ultimately the best. The text message that we get at the end, right? that text message that says, I just appreciate you being here. And if someone's looking in the room, a lot of the times I'm just sitting there talking. You realize where you need to move or where you need to act. You start feeling the energy in the room. Sometimes she don't want you to talk to her. She don't want you to touch her. It gets to that point, but we understand that that's a part of the process. And when she starts throwing up and you got to go find the cup right quick because now she's in transition, and we understand that, and now we're trying to do a lot more to talking to calm her, let her know you're almost there. All of that it's kind of put tears in my eyes, but I just love it every time. Every time I love it. So that's what a doula is, and that's what a doula does.
That's so powerful. And Rima, and I'm just gonna start off by saying, she said, listen, I may have to go because one of my moms are almost ready. So with that,
Right. So my phone is here, so I'm not unprofessional.
She's like,
I'm finished for this month, hopefully.
So with that, I'll say a disclaimer. What is a doula to me? So by textbook definition, a doula is a mother servant. Do I feel that I am a servant? No. So that's why I said by textbook definition, it is a mother's servant. I am not a servant. I am everything other than a servant. I become a friend. Sometimes I become family. Sometimes I become, the sister. Sometimes I become the mother, especially to a broken birthing person who does not have that motherly foundation. So sometimes I find myself saying, so how did you dress before you leave out? How did you do this before you leave out? And they're like, but Rima, and I'm like, no, you're supposed to do something other. So by my definition, I feel like I am a family support. And I say that because the definition says mother, but you have to think about it's just not the mother anymore that you are solely providing for. So it is a birthing person, it is a birthing body, it is a woman that is giving birth, but soon as that baby is here, it is now a family.
especially if there is a partner involved, whether it is male or female, LGBTQ community, we do it all. You have to go full spectrum. So I believe all of these doulas over here are full spectrum. That is what a doula is for me. It is a family support person, not just a mother servant, because that means that you are excluding other people when it is a close-knit thing, because you become an unlicensed, unattended therapist as a doula. So you're not there, you don't have no studies for this or anything, but in time, you become their therapist. So to me, that is what a doula is. It is a family support person who is an unlicensed family therapist, family coach, a mediator, right? An advocate. It is everything other than a mother servant.
Wow, this is amazing. It covers a magnitude of different, as depending on where the birthing individual is. It could go from appointments to labor support, and everything that you said, from this quasi-therapeutic role, emotional support. Okay, you're about to transition into the actual birth. What does the training entail? And how does the training that you go through to become a doula prepare you for such services?
I definitely, I'm sorry, Toby. So it all depends on the training that you go through. And I'm going to say you have, not to offend any organization, not to offend anyone, but you have those trainings that are, what did I just learn? So you walk in, you walk out, and somebody says, "But you have to know something." I said, "Yeah, I got my certificate of attendance. That's what I know." But you do not leave with all of the tools that you need to be a successful doula. And sometimes you double train. Sometimes you triple train. Sometimes you need to go to other trainings to get what you need in order for you to serve the population that you want to serve. So there are a lot of organizations that are not for the ethnic community or for the urban communities or for the lower income communities. So what we're dealing with is more Caucasian-based service. And those are the people who actually know of a doula versus the ethnic group, which will be the Hispanics, which would be the background communities. So when we're doing our trainings, sometimes our trainings is only 2 days, depending on the organization you go to. And then you have those beautiful trainings that are a week. Sometimes there are months, which is 2 to 3 months. So it is a different variation when you're going through these trainings, and you have to find the training that is for you. I went through 6 trainings.
Wow.
So, so when I say you have to find the training is for you, I mean that in full heart, mind, body, and soul. You literally have to find the training that is for you, because every training is not going to give you the tools that you need. If you're walking into it and think that when you leave out, you're gonna know how to, as your first birth, how to deal with the mother for vaginal support, or a mother who has started doing vaginal and then now needs to do cesarean. You're not gonna really know that, because you have to go out in the field and go, but you will be confident in it if you pick the right organization that gives you that welcoming love, the community of practice, the come to me and talk to me anytime you need it. So that's my take on organizations.
I had the pleasure of taking the Zaza Village certification. Like, that is the one certification that I took, and that model of training specifically, as I put it here, for my certification under the Zaza Village model, it involves 8 intense consecutive 8-hour days of learning and bonding over the coursework to create a healthy awareness of giving birth in our community. Like, so the main focus was because we found out in the training that it was a pilot program that was sponsored by the state of New Jersey, leading up to the Nurture New Jersey launch the following year. And so for that, I feel like the state picked a really good model to train us under. And I mean, we got to meet the founder. She came and trained with us. And the other part of the bonding with the women in the room, that was so powerful. I must say, I'm a single mother of 3. Today is my only son's 34th birthday, so I told him, you know, I'm going out here to, you know, thank you, go out here and represent for you and all that kind of stuff. But the power in what took place over those 8 days, because we have women from different age groups, everything from Latinas, from 20-something-year-olds to like 50-something-year-olds. And we've all had different birthing experiences, birthing losses, supported and didn't know we were supporting kind of situations. I mean, we cried with each other. We learned. It was so powerful that it developed a sisterhood that right now, me and Gloria came through the same class, and me and Irema came across each other again because the circles aren't big. We know our circles aren't big. Me and Irema ended up at the same job as I came. I mean, Irema was leaving, but me and Gloria had clients together. We trained together. We haven't seen each other in so long. I saw Irema when I walked in the door, but when I said, is that Gloria? You know, because we haven't seen each other for so long. But that was such a foundation and a catapult to sustain us. Because to get out there in these doula streets, as we call it, it was rough. Wow. It's still rough. Like some of what we have to deal with on a daily basis when we going in these facilities. And I work in a facility that I can't get them to do this. I fight every day. And I want to walk. I want to walk, but I can't. You know, I'm still fighting. And I really know a lot about the fight that I'm fighting. But I'm still fighting, and I manage my private clients and all that kind of good stuff. But I love the fight. I think.
But this is so you mentioned a very like peer sister,
and for
It's a sisterhood.
right as a part of training, and then you mentioned the lymph training, and you can go from a few hours to you kind of
8 days,
midway,
8 hours a day.
8 hours.
And
Gloria, you attended the same training.
I attended 2 trainings.
And what made you attend 2 different trainings, if you don't mind?
Prior to my first training came on, let's put it like this, a white woman supervisor, my old supervisor, saw the doula in me before I did. I was a community health worker here in this first SPAN, Statewide Primary Advocacy Network. And the project was called Improving Pregnancy Outcome. And we were out there doing the field work, doing the boot work, you know, the boots on the ground. But we kept coming back to reconvene, and the people we were serving were already moms. You know, the people that we were getting assigned were mommies with babies. So we kept coming back, and we kept saying, what pregnancy are we improving? Because they've given birth already. So what are we improving? Improving pregnancy outcome. Which pregnancy are we improving? The next one? Because, so it kept coming up, and that supervisor developed a pilot program. And she's like, oh, you guys are gonna take the doula training. I was like, oh, gee, thanks. She's gonna give us more work, not more money. But she discovered in me, she knew I was a doula before she saw it in me. And I took the first training, and it did a year. And then they wanted to expand. Now they brought in, we flew out. Myself, I was blessed to be one of the ones who fly out to Missouri.
Oh, wow.
And meet the Uzazi Village founder and go to one of their trainings. And that was through AMCHIP. And the following summer, they decided to bring the doula program here. So the first 4 that took that doula training, we were in that 30-something class with Uzazi Village. Out of that 30-something class, I think only 17
18.
survived, finished through, because it's just light.
And even after that,
It
maybe
started
12.
dwindling down, right? But I love it. I considered myself blessed in the sense that I took, the first class was probably, it was 3 days of maybe 20-something, 8 hours, 4 days. Like a 32-hour class. And then the second class, the Juzazi Village, was the 8 days, 64 hours, or 8 hours. So it was intense. It's a lot of information overload, but the sisterhood that we bonded over, it brought understanding to a lot. I started understanding what I went through as I had. Now, mind you, I'm a mother of 3 and a grandmother of 4 and a baby girl on the way. Yes, hallelujah. Because all my grandsons are boys and I don't have a girl yet. So she's on her way. But, and I am her doula. Yes, absolutely. I am her daughter's.
And true to form, I'm sure all of us would agree, we never stop learning. Every time we get a chance to be on a webinar or a class or something that interests us to learn more, we do.
And even with our own experiences, because when we talk about the trainings, when we talk about a loss, a mother's loss, and being a full spectrum doula, let me tell you, ladies, she knows. Tonique knows. Sometime last spring, I went through a birth and it was supposed to be a normal baby. She died in the birth. Ooh, talk about knocking you out, knocking you down from the horse. Getting back on that horse, but having that sisterhood of women checking on me every day on how I was doing, because when they say do not get mixed up with family in doula work, that was a lesson learned for me. I knew these kids since they started, and when that young man, I seen him grow in that few seconds. He just kept saying, Gloria, tell me he's gonna be all right. And I had to look at him in his eyes and say, I can't say that, puppy. I can't say that. To see him grow in that moment in front of my eyes, it was like, whew, it knocked the wind out of me. And all my ladies, all my sisters in this work, in this field, they all reached out, giving me that support, me being supportive. I went through the grieving process, all of the above, of loss.
Wow. That's very powerful. And thank you for sharing that with us. And it just shows the extent of what you do, of what all of you do. There was a time where doula care was not covered by Medicaid. And as all of you probably know, 30% of the births in New Jersey are covered by Medicaid. And among those births, we do have a number of Black and Brown people that are birthing individuals. And we are very excited that we can offer doula services through New Jersey Family Care. And I want to understand, based off of your experience, you've been doing this 12 years and all the years combined, how do you become a community doula through Medicaid versus, Gloria, you're a private doula, versus being a part of an organization? And what is that process like? Well, I guess I'll go first, since I probably have enough of the bumps and bruises to go along with it. And the reason why I have the bumps and bruises is because a lot of it is, that's the community I want to serve. I just want to be a community doula. Like, that is what my whole training was. I was not prepared for the fact of the state making it something that we had to go through so much to learn about medical billing, the whole credentialing process, being credentialed by every insurer, and now every insurer have a different billing. Like, it's been so much. Oh, it's been so much and so painful. But I've gone through it. Even to the fact I've started credentialing and I went through it. I started credentialing and they weren't actually acknowledging my personal application. Then I decided to work for FQHC, and FQHC wanted to credential me as well. And I don't know, maybe because it's a big entity, the insurance carriers looked at their applications and still did not look at mine. So now I'm actually credentialed for FQHC. They can't actually bill for me. So it was making a convoluted situation when I was trying to submit billing for my private clients, because they didn't have me credentialed as myself. They had me credentialed as a provider with this FQHC.
So for people that don't know, what do you mean by credentialing?
Credentialing says that you have all of the certifications or you meet the requirements. First of all, you have to meet the requirements of fee-for-service with Medicaid. And so once you meet those requirements, and then they have MCOs like Horizon NJ Health, Aetna, United Healthcare, AmeriGroup, and WellCare. Those are managed care providers under Medicaid. So it seems like what it is you apply for Medicaid, and then once you get approved for Medicaid, you have to pick an MCO, which is a managed care, for your care. And so if that person has, say, Horizon NJ Health, I would receive their Horizon NJ Health Medicaid information, and I would submit a claim to Horizon NJ Health. So Horizon NJ Health would prefer me to be credentialed, which is the same or similar process that I had to go through with Medicaid. And so now they're going to take another 60 days. And so I have to do like a 60-something page contract, submit it to them, wait for them to review it, send it back, and then for them to say, okay, you're credentialed. And then I have to do that for each and every MCO, which each and every one kind of has their own set of rules. And that takes away from me just being a doula. Like, the part that really baffles me is that under the age, we got trained under Span Uzazi Village, which came under a body of sister-to-sister community doulas. Now, sister-to-sister, what we did with sister-to-sister community doulas, we had a team, an administrative team, which Gloria was a part of, that would receive requests for doula support. And the administrative team would get the doula, the clients would screen them, find out what their needs are, what level of doula support they need. And then based on the doulas, under sister community doulas, we would be matched up, quote unquote, because the person that was doing the matching, our supervisors, they knew us, you know,
Personally.
they knew us personally. They knew what our strengths were, they knew what our weaknesses were, they knew our availability, because we would let them know, you know, what was going on. And basically we had to kind of be bonded with them for at least a year after we got our certification, because they, you know, mentored us for, you know, at least a year. And so once we got matched up, we initiate communication with the client, and we also had a backup that was also assigned. So we had a conversation first based on what we knew about the client, then we go and we meet the client. And we had a responsibility of minimum 3 prenatal visits. One of us is assigned the primary doula, the other one is the backup. And if the backup ended up having to go in for the primary responsibility of labor and delivery, now she's the primary because she stepped in at that critical point, and we all understood that. And at the end of it, as far as the visits and the labor and delivery, we submitted a paper invoice, 1-page paper invoice, and wait for our check to come. when the state decided to do Medicaid and we had to do medical billing, it's like, what? We have to get an NPI number, we gotta get a Medicaid number, all of these applications, submit this document, that document, fingerprinting. What? And so we have a lot of doulas that train with us, right with us, that refuse to go through that process, like my friend, my
Amen.
girl, Gloria.
Amen.
She will not go through the process, and I have registered the caring doulas as a business now, and one of my biggest things is like, I have to find doulas, and it's hard to find doulas that even want to do Medicaid. I'm gonna talk with Gloria before she leaves, because I pulled in some people that we really know, and we're gonna have a meeting because I have to pull it together. There is not enough doulas in New Jersey, period. And I mean, I don't know, I'm not really sure where the state is. And so maybe I'll talk to you either to find out where is, I mean, because I know Health Connect 1 is there, I know the DLC is there. That's not enough. I mean, even I can talk with the city too and try to get Mr. Baraka, we need to get something going on right in the city. I want to know what's going on with the Shani Baraka Women's Center. We need to have doulas coming out of there. Like, let's get this going. Because I'm telling you, I said it on many calls. If we don't use this, they're gonna take it away. This is a political thing and it's politically involved. Let's get this thing going because our community needs doulas.
Well, first, I just want to say congratulations and thank you, because you, like you said, you are a fee-for-service provider and you went through all three. So it's very possible. And I think what you're speaking to is a great need, that we do have to build out our workforce.
Right.
And the process, you know, one of the questions that I have is what doula services does Medicaid cover? Because one of the things you said was you had 3-to-1 visits before. And one of the things we heard at the state was, we want to spend time with birthing individuals, whether it's before or after. So we do offer 8-to-1, eight visits to 1 labor. And then in addition to that, for our younger members, 19 or under, you have 12 visits. And that it's a lot of work on this end, but the benefit, I just want to hear your perspective on the actual benefit once you're finished with the red tape to get there, if you don't mind sharing your experience.
It's rare that I get a client that actually do all 8 visits. Typically, my first visit, I let them know you have 8 visits. You can do the split however you want. You could do 2-6, you could do 4-4, you could do 5-3, well, however you want. For first timers, if I have the time frame, I try to get them to do the more on the front side.
Okay.
Or either a good split, 4-4. Just because they might need a little bit more assistance on a mom that had a baby 2 or 3 times already, they might benefit more from a 3-5.
Okay.
You know, something like that. I've had one mom that was 19. She was 19 when I first met her. So she had the 12. I think we probably got about 10, up to 10 visits in her labor and delivery support. So that's one thing. But with sister to sister, just the fact of doing a labor and delivery can definitely, you can easily do 12 hours at a labor and delivery. You can do 2 days at a labor and delivery. I have walked in and did 2 hours sometimes, you know, and that's a rare, but through sister to sister, we would get $550 for a labor and delivery. Through Medicaid, it's $235.
So there's a payment difference in terms of what you do.
A big difference.
If I can add in double advocate to this, right? Soon as it was last year when they launched the whole Medicaid, for me, my process was easy. Which a lot of people was like, what? So a lot of people actually come to me when they're like, it's a Medicaid question, I'm tagged in it. Like, I'll ring the nose, she did it flawlessly. But I'm just one of those people that I do not wait for someone to tell me how to do it. I'm going to bug you. So I know you said, I know you said, I've seen your name come across the screen 50,000 times. And that's because I feel like it would be a disservice to me and the population that I service by waiting for those, as Tony said, webinars, waiting to have the one-on-one meetings, having this. I'm like, they're gonna get tired of me. It's to the point now where some of the Medicaid side, on your side, they're like, Arima, just call me on my cell phone. I'm like, all right, no problem, I'm gonna call you on your cell phone. But I did that like at the top of the year as soon as it dropped, and it was like an easy process. Yes, I did do fingerprinting. So when you have a doula that's on the Medicaid, trust me, they went through fingerprinting. There's a criminal background check that was cleared. So I do want to let people know that you do not get that when you're just training on a regular organization level. So I want to make that clear. I want to clarify that. But for me, it was easy. So I went through the whole NJ family care process because that's what you initially have to do. You have to be certified at that level. And then, like Tony said, you then have to go into the other MCOs. Now it's up to that doula if they want to be contracted, and that's a part of the credentialing process, to be contracted. So I am contracted with all the 5 Medicaid MCOs and I have no issues with any of, they don't give me no pushback. But that's just me being, I'm still somebody put the foot on the neck and I'm like, yeah, they're like, all right, Arima. So I am one of those people. But when I'm working with families that have Medicaid, $235, like Tonique said, doesn't cut it. Because I can let you know right now, for the whole reimbursement, if they do all of the visits, and like Tonique said, some of them don't do all of it, a regular 8-in-1, you're gonna get less than $900.
It's about 9.
About 9 or some change. And if you do the high risk, what high risk is considered a teenager, even though gestational diabetes can be high risk, high blood pressure can be high risk, heart disease, any heart issues can be high risk. So I have no idea who has written that teenagers is just solely the high risk, you know what I mean, demographic, when you have other things that contribute to it. As being a high-risk person. So I think that in one needs to be expanded as what is considered to be high risk. It is below, it is below some of my services that Medicaid is only providing an 8-to-1. And I say that, and or the other one, which is the 12-to-1, it is below what these families deserve. There is no way in postpartum I can give a mother my time for only 1 hour, especially who had a cesarean or who had a trouble birth. So if she had a cesarean and I need to help her to get upstairs, if she lives upstairs in a house, and a lot of my clients have houses, or they have apartments, I need to help them. They just had a major surgery. So you're telling me I have to be at this person's house for only an hour? And I can only bill for an hour. And you literally have to shift some of your work to make it work. So it's like, okay, so how about I come to your house at 11 o'clock at night so it can roll into 12 midnight the next day, so I can do another postpartum visit so it can be under the next day's bill, which is then I'm doing my 2 hours. You shouldn't have to sacrifice like that, or you shouldn't have to do anything like that. It should not be a cap on my postpartum care. Now, if you want, it could be 3 hours, but 1 hour? Now, the prenatal visit can be 1 hour, but sometimes my prenatal visits are 2 hours.
Yeah, but this is really helpful because, and hearing about, I guess, all the depth of everything that you do, and in terms of ways to improve, one of the things I hear is to really think about the care that's needed versus the time allocated. And the other thing that I hear is really interesting that you two have 2 polarized experiences with the process, but really thinking about what made your process much smoother, even though you were the one kind of pushing it. And then Tonique, how can we be more responsive for individuals that may not have the as you called it, the foot on the neck?
And I'm glad you guys brought that up. That's the reason I pulled back. At the end of the day, nor the 550, nor the.
And then the
close
payments,
to the-
I heard that.
Close to the 900 is gonna pay our daily bills.
No.
So we all have regular lives to lead. Although this is our passion, we still have bills to pay. So we have to take on jobs, you know, to make careers, to continue our daily
Passion.
lives. And sacrifice our passion. So here, I cannot put my foot on that gas because I'm like, I don't have the time or the energy and all the red tape that comes. Here, we had something beautiful going on, the development of the Yazazi Village, the training here, the sister doula, a community doula program. And I felt, I'm gonna be honest, I felt, oh boy, here comes the bureaucrats, here come Uncle Sam, here come the white people, they want their money, they want money. They want something that we have going, and they have to put their 2 cents in.
Let me ask you a question about that, and maybe not to that, using, you know, those words. In terms of funding and doula care and community funding, how has the transition to Medicaid improved that as a way to grow the profession as well as offer services?
I know for me, I have no issue having clients. My phone goes off a lot because I'm listed on the MCO's
And
website.
Tony, you're probably the same because we
So-
don't have as many, so the need is greater than the.
So my phone goes off, and like Tony said, the organization that she was at, me and another doula was the first doulas. So we built the doula program at the organization.
Wow.
Is it a steady, like she said, it's a steady thing there, but now I'm at a whole different company. And this will be my 3rd doula program that I'm building for an organization.
Wow.
And it's a major medical school in the state of New Jersey. It's the #1 school, so if you know it, you know it. I have the privilege of doing their doula program. But with that, I get to also meet some of the clients there, you know, so that helps outside of me being listed on the MCO's website as a doula provider. So for me, my stuff is like crazy. It's good. It's flawless for me because I have people emailing me, texting me, hey, I seen your information here. Can I get it? Can I get it? Or I've seen your name floating around here. You were on a business card for this past organization, or this organization. Can I get it? So for me, that is not a hiccup for me. The only issue is the payment. That's the hiccup, because it's like, how many Medicaid clients am I really gonna take without sacrificing my personal assets, my bills and stuff like that? So one client I'm pretty sure Gloria and Tony, they're experienced doulas. So their fees is probably what Medicaid pay is probably either half or 1/3 of probably what they would charge a cash paying private client. So that says a lot.
And it also says a lot about our country in general, like how payments are set up, and not to, you know, discount what is being said, but there's.
But even as a private doula, because I started as a community doula, and proudly, I love serving my Black and brown community. I believe that no woman ever should go through that journey by herself, through the birthing journey by herself, through pregnancy by herself. Because so many things, especially when it's a first-time mom, a doula, so many changes that our bodies go through, and we don't understand them. And at least if we have, and maybe we feel intimidated by the medical community, or they give you the brush off, the 15-minute visit, next, and that doula, that sister doula can help you understand what your body's going through. That sister doula can help you understand when you're a first-time mommy and your fear. The biggest fear is, how am I gonna be a good mommy? We all in this room, anybody who have had that fear.
You know what, I want to lean in a little bit to that, and thank you for everything you shared about the procedural part. But what are some of the common barriers that you see your clients face with accessing prenatal and postnatal care, and postpartum care? What are some of the barriers?
When I say I concentrate and my passion is the Latino community, I mean that wholeheartedly. One of the reasons I named my company regalobirths.com, regalo means gift. And I needed it to have the Spanish touch to it. I needed for people to know when they read it, they're like, oh, wait, she might speak Spanish. I needed that. Because I need my moms, my Latino moms especially, to know we're out here. As doulas, we're out here to support you. Why? I feel they're underserved already. Black and brown are underserved, period. But when it comes to the language barrier, it's a whole nother level.
And do you
Why?
think that's a common barrier that you see
That's
in
a
your?
common barrier
Okay.
that I see in the Latino community a whole lot. But it's sad because you'll see a white-skinned woman. She's Latino, she still gets discriminated against. So don't get that twisted. You know, it's not only the skin color, it's deeper than that. It's the fact that they think they can just invade certain privacies or that the language barrier. I've gone to a hospital and it's a school, not school, yes. But they have the tendency of bringing in the students.
Yep.
Into a birthing mom's room who's already vulnerable. You know, she's already in her own fears and her own thing going through the birth. And all of a sudden you have a bunch of students looking at your hoo-ha who's out and about, you know, trying to do her laboring thing, and you gotta worry, and she's feeling invaded, violated, all of that. That's when I come in. I'm like, she doesn't want students in here, just the doctor.
So I heard students, I heard language. Tony, what are some of the common barriers that you think your birthing individuals face?
Some of the common barriers that I know on a regular basis, like there's a young lady that's at the top of my head that I have to follow up with. I've had a crazy past couple of weeks, but I'm going to circle back around to her. I was contacted by a young lady that she was about 12 weeks pregnant that she guesstimated, and she was looking for a provider, and she had been calling around to different providers that she found on her website, and she hadn't gotten anybody. She would call, and once they started taking her information, you found out what insurance she had, and they would say that they weren't taking any new patients. So a lot of what she explained to me was she didn't want to have to, subject herself to go into a clinical setting, like a clinic setting. She wanted to go to a private provider, like where she goes to, that's who's seeing her, that's who's going to deliver her baby. And a lot of the providers she was calling, once she started letting them know what insurance she had, they weren't taking any new clients. So I hear that a lot.
And would you say that's access to care?
Yes, that's basically access to care. Another thing is I found moms that would like to give birth at a birthing center. Okay, so a birthing center, there's a birthing center right on Route 22. There's a birthing center in Morristown that you might have to see if you can find out about that raffle that they have, that you can do an application, and maybe your application might get picked. After you fill in all your demographic information on this paperwork, somebody takes it, and then there's a raffle that you might get picked to have your baby at this birthing center. There's a couple of hospitals that has a birthing pool in it, but it's a first come, first serve because they only have one. So access to equitable healthcare is still not. It still does not exist. The birthing center on Route 22, we might consider taking these one or two MCOs, but one is specifically acknowledged here. And if you do have the other two, do you have another $3,000 to $5,000 that will cover the expense of having a baby here? Because what Medicaid pays under that MCO does not cover the expense of having a baby here. But I qualify for Medicaid insurance, so why do I have $3,000 or $5,000 sitting around? To also throw in the expense of having a baby, isn't insurance, this insurance is supposed to cover everything, right? But that's not the case. So
So you say that, and I don't want to, is that options in terms of where a person may want to deliver or have their
it's definitely like,
I've served different hospitals, different expectations, different services provided.
some want you to walk in with your certification in hand or not.
Here's the thing, but then here comes the burden center, and it's a total different experience from a hospital setting. It's more homey, and yet you have professionals there. And it's, for me, beautiful experience. Tonique said it best. They only accept one insurance fully, one MCO fully, and not all our clients have it. And it's not fair to them, you know, for them not to be able to have
The experience
the
that they
experience.
want.
Sometimes I limit myself of what I tell them what they should or they could do, or they should experience that, because I already know whatever MCO they have, I'm not gonna be accepted over there. So you limit yourself, you know, it's,
Right
those are
down
some
to
of
what
the,
is covered by each carrier. I had a client that just gave birth last month in July, where she was teetering on the gestational diabetes there. You know, sometimes it's high and managing to be high, sometimes it drops low. And she couldn't find the machine to go with the strip that was, like, it was a back and forth thing. Like, just for the management of gestational diabetes, she was having she didn't understand the insurance benefit policy, what was covered, so those are such challenges.
and are these opportunities where all of you can help as doulas and you?
Yes.
So in that case, what would or have you done to help?
It was contact your insurance carrier, let them know what the problem is, and get back to your doctor. So it's a back and forth with the insurance. You know, I instruct her to get her insurance carrier involved because this is a serious situation, you know, as far as you managing gestational diabetes. So it worked out that, you know, she was able to get the insurance carrier, the doctor, and the pharmacy to coordinate and get what she needed.
And I know we're coming up on time, and they're one of the major components of doulas is being a labor support. And I want to at least give the opportunity for all of you to just discuss your delivery room experience and specifically around what are some of the things you may witness in delivery rooms that contribute to high maternal mortality rates in our state. And then in addition to that kind of double whammy, how are you received in the delivery rooms?
I can answer that. So in my experience, I feel like you're always going to see something different happen. But you cannot walk into a labor and delivery room as a doula with I don't care, this is my client, you're not gonna do this, you're not gonna say this, because you can get banned real fast from that hospital, that floor. You also can't come in to labor and delivery with so what am I supposed to do? I need to call this person. You can't call your mentor, you can't call everybody every second. So it's like, you have to have enough knowledge to be able to navigate in that space. So what has helped me in L&D before I realized all of the nooks and crannies is when you're walking into L&D, you have to make your presence known. And I mean that by not being obnoxious, not being rude, not being a jerk, not being the I know it all, but, oh, hi, if you see the name badge, Hi, Nurse Charlotte. Oh, this is the doctor. Hi, Dr. Rich Colette. My name is Alrima. I'm the doula. Or like anybody who comes in, you greet yourself. Hi, this is me. Hi, this is me. You know, how was your shift today? Because they could have been on a double. It could have been long. So you want to make that room so it becomes to the point where it's you and your client's room. It's not you and your clients in the whole floor room. Because if they feel like you as a doula cannot manage that room, guess what? They're gonna keep coming in every hour, every 2 hours. If they hear the mom like, you want an epidural? Okay, all right, I'll be back. You want an epidural? Okay, I'll be back. So you have to be able to control not just what's in that room, but the outside room. You have to pre-game your client before you go to the hospital. For me, I do scenarios. I run through, I do the aggressive doctor, I do the nurse who's just gonna do something without informed consent. I do the people, even the triage people that's coming in, hey, we just wanna get register. Hey, did you knock on the door? You ain't do nothing? Like, how you know she wants you in this room? You know what I mean? Even though it's not a time to be modest because she just really out, but informed consent comes as soon as we come into the hospital. I make sure my client has her birthing plan on hand. Even though she probably gave it to her provider already, we're discussing that as soon as she steps foot into the hospital. They're putting her in the room, they're strapping her up to monitor the contractions. That first nurse has it. If they need to change shifts, she has another one to give it to the next person. And it's because I try to do that to set the tone in the room. So it's not a thing for medical intervention. Because I have seen nurses, doctors, and as much as people want to highlight midwives and say, oh, midwives are more natural, they're more pro this. If they are a medical inclined midwife, you're not really going to get that. They come in, this is literally how they'll come in the room. They'll speak to a client, they'll be like, okay, so we want to check you. If you can just lie back now, we're going to check you, put you in a bed bag. And the mom's like, oh, okay, do you feel any pressure? At no point did you just hear me say, hey, would you mind if we check you? Do you think it's time for me to check you? How are you feeling? And that is what's missing in the room is informed consent. They're not asking the person, how do they want their birthing experience to be, or, let me help you. It's more of, I know what I'm doing. I've even had a doctor come to me and say, I've been doing this for 50 plus years. I know what I'm doing. Wow. I prevented a lot of cesareans by having the mom have the epidural get cut off and get up out the bed. I said, girl, they're about to come in this room because your baby's heart just keeps dropping. It's time to have the epidural off.
And part of maternal mortality is talking about cesarean section. Mm-hmm. And Gloria, Tony, what is your experience in terms of the delivery room? And being able to say, wait a minute, I want to advocate for an alternative or a different approach to what, like you said, going into an environment where the medical model may take precedence over the birthing plan. So Gloria.
That normally, like Alrima said, you can't go in there cocky and bold. You have to be diplomatic and politically correct. So how I go in there, and I'm known as the donut doula because I'll buy a dozen donuts before I get there. Yep, I'm the donut doula.
Yeah, you got to come in there with gifts. I'm trying to tell you. You won't have to wait with gifts.
Hi, so who is my delivering team? Let's do this.
Hey.
Here you go. I know you've had a long shift. Yeah, I'm politically correct. I'll kill you with kindness, real quick in a hurry. But why? Because I need to make sure that I get control of that room. I need that team to know that I'm gonna be, that I got this. I have it under control. Go tend to the other, birthing folks, no problem. I'll tend to mine. And why? C-sections. They come in all sorts. They'll come in there with all kinds of excuses of why they need to do a C-section. And sometimes they're not medically necessary. Sometimes you can tell when they're trying to push the clock, when they're trying to push the clock in order to finish their shift.
24 hours.
That 24 hour. And I start like Arima, I'll do scenarios prior to the hospital visit, prior to us getting to that. I start preparing the husband, the partner, whether it's a female or, I start preparing the support team for that mom ahead of time of what to listen for and what to stay focused on. I have to start preparing them. I'll look at my clients a certain way.
That's what I'm going to say, like you preparing for a poker game.
You are.
Yeah,
I have code words. As soon as I say my code word, I'm like, oh, how do you want this? And they be like, oh, something about to change.
and you have to prepare them that way because they will come in there and give them all these medical terms and they intimidate them and scare them and all this. And sometimes, like our Rima said, if you haven't won that client 100%, they will turn and they will go with whatever that medical, and you're like, and you're like, what just happened? Real quick, and but you know, at the end of the day, I always tell them, I'm only informing you so you make your decision. You make the best informed decision possible for you, for your family, what works for you.
And that's really good.
And I'm here to support you guys.
Right. And I don't mind to clear the room, because I'll clear the room. I will. And my client, I look at my client, I'm like, girl, it's time to clear the room. I'm like, oh, I think my client just needs a few seconds. Can we clear the room? And then I've had nurses, even the provider looking at me like,
But cleared the room from even her mom.
yep, I have. Parents are very, very, if you have those type of people, parents, family members can be very, very toxic in the birthing space.
I think what all of you shared is this work is not for the faint of heart.
No.
I've heard.
And but everything that we talked about, from the training to transition to Medicaid to what Gloria shared, the unfortunate outcome of one of her families. I think we all are here to first highlight that everyone deserves well-being and everyone deserves, it's their human right to have the best experience. As it relates to what you said earlier, we can happen naturally. It's been happening for years. And I want to say, thank you so much for sharing your experience, the depth of your experience, your knowledge, and for championing people who may not always have the correct vocabulary, voice, confidence, to advocate on, for themselves. And with that, I do want to give the opportunity for people to ask questions. I don't know where we are with time. I'm sorry, we didn't do a code word. Because I love this work, I could sit here all afternoon.
I can too, so there's no time limit to me when I need to talk. I'm like, keep that thing rolling. Yes, I'm here.
One thing
I was going to say, if you could just give some last minute words about.
I have seen gradual change in how we're received in the hospitals and stuff like that. Like, there are still hospitals that are still trying to get acquainted with us, but one that I'm frequently at, North Beth Israel, they're very receptive. And they know me when I come. Oh, hey, it's wonderful. And I get the utmost respect once I'm in the room with my client. We hardly ever see the nurse. I don't at Beth Israel. Once I'm there, I rarely see the epidural train, that I call it. They come with flags and whistles and bells and treats and stuff like that. And even one of the hospitals that I used to feel like was the worst, I had one of the best experiences recently, that they actually let the mom labor without the epidural for the whole extent, and she actually had the birth experience that she wanted. And a lot of the reason why she did not choose to have the epidural, because she felt like that was the reasoning for her less than a year ago stillborn baby when she got the epidural. So she was adamant on not getting the epidural. So she stood by her thing, and they let her rock out on the birth ball, and They let her squat and they let her do everything she wanted to do. And she had the birth experience that she wanted. And at this hospital that she had just experienced like a year ago. So you really want to go back there? You sure? She's like, yeah, I'm gonna be, I'm empowered now. And it happened and they allowed it to happen. So in that, I can see over a 3-year period, the tide is changing. It's just need a lot more pushing. And I think what I can advise for the state is the Nurture New Jersey initiative need not pull away from the doulas. They need to keep hearing the doulas. They need to keep listening sessions with what's going on out here on the streets. They need to make ways where a sister-to-sister community doulas can become the caring doulas and have the same team, something similar to what supported us as doulas, have to be able to exist and support it to exist. There really needs to be access to more training. I know a lot of people that I know and know of what I do would like to become doulas, but the craziness of what all the different certifications, if you go and Google a doula on Google, like all of the different certifications that come up, and what is applicable? What would work for someone that don't know really what would work? So I think there needs to be more open access to the certification and training.
And I'm gonna agree with that. I'm gonna piggyback on what Tonique is saying. For someone who is passionate with my Latino community, my Black and Brown community, I would love to become Medicaid certified, and all the MCOs and whoever else needs to see my.
Don't worry, I'm gonna take and hold your hand.
But at the same token,
Tonique, I'm right with you.
but at the same token, I need it to be easier than it has been.
And worth it.
Because,
One thing I can definitely say, and I don't want to interrupt you, please hold your thought because I don't want you to lose it. But one thing I said to Gloria when we first sat down is, we can only physically, mentally manage about 2 births a month. 2 births a month.
More, God bless.
I do.
Yeah.
Okay.
And actually I do too, but I have now dedicated at least 1 weekend out of my, I'm getting away, I'm turning off, and I can't talk to nobody. Because I have to be able to decompress if I'm doing more than 2 births a month. And I try to not take anybody to do within 14 days now, because I've had it where 2 people do at the same, two people that weren't due at the same time actually went into labor at the same time. I had to make a choice. And I had to feel so bad about the one that I didn't get a chance to be there for. But so I can't, like, 2 is good. And if you want me to do this full time, I need to get paid maybe about $2,200 for each.
But this is what I'm gonna say. We hear you. We've heard doulas from day one. We've heard doulas in terms of designing the benefit. And I wanna say personally, I sit in on meetings where I know the voice of the stakeholders come through. And I think this is a partnership. We're learning, you're learning, and I do think that, like you said, slow, adaptive change is happening. And with that, I just want to say thank you so much for your contribution to this discussion. This has been a lot of fun. And
Thank you for taking our.
It wasn't just a question,
yeah.
For having us.
Thank you. Oh, were there any questions? I'm sorry. Are there any questions?
Girl, put your hand down.
Mom's a good doula.
I don't have a question, but I did want to say thank you so much. I learned a whole lot this morning, starting with the very first question. What is a doula? Because I know I'm not by myself, but I suppose the same thing as a midwife, right? So I appreciate you guys a whole lot. and look forward to actually more of these types of conversations and sessions, definitely here in the library throughout the state, to help support this cause of having a community.
Maybe you guys
Absolutely.
can host a training on the Medicaid process.
Let's talk about it. We can absolutely look into that for sure. And then offer it in Spanish as well.
Absolutely, I'm all for it.
Absolutely.
And Creole, because.
Creole is a big thing. Yeah.
Let's do it. So thank you guys. If we don't have any more questions, we can log off to Facebook. Thank you guys for joining us on Facebook. Yes.
Wow, very impactful.
So, we are going to hear a very loud, annoying fire alarm sounding type bell. That lets us know that we got about 10 minutes to clear out. Yeah. So, but we still have about 5 minutes. If you guys please have some refreshments, before we leave, chit chatter.
Okay, all of you. Just to let you know, I'm the new doula guy. So I don't know why. Yeah. Listen, I did it on purpose.